Hello, I'm Alex. I'm a theatre researcher and a performance maker, and I have a special interest in medicine, experiences of illness and healthcare in relation to theatre and performance.
Hi, I'm Sara. I'm an ex-clinician and a social scientist researching healthcare practices, and I have a great interest in theatre and the performing arts. Alex and I formed a collaboration last year based around these complementary interests, and were thrilled when we got the opportunity to convene an event, which we called Performance for Care, about performance in the education of healthcare professionals.
So as the title suggests, we had a particular focus on those healthcare professionals at the point of care, so an interface with patients. And thinking about the sort of skills that requires in terms of emotion work, communication skills, sort of social skills, also the kind of ideas about embodiment and critical self-reflection.
Yes, and we were interested in the performing arts, by which we mean theatre and dance in particular, because they are embodied, experiential and interactive, and therefore offer a useful point of access to those competencies.
So the aim of the event was to bring together educators, academics, researchers, policymakers in both healthcare professional education and in the arts and theatre and performance particularly, and together to map out some of the policy landscape, share examples of practice, and above all to debate how performance might be more systematically embedded in the education of healthcare professionals.
The event was planned for March, just when COVID-19 struck, so we redesigned it as an online platform, which launched, so to speak, on the same day as the planned event. We owe a big thank you to the delegates who filmed their presentation at the very last minute. The online setup meant we reached a much wider audience, over 400 people on the day, and that there's a legacy of the event. But we had to sacrifice the group discussions. So this video is a first step towards the fuller discussions we hope to have in 2021.
So the event gave a really useful snapshot of this field of performance in the education of healthcare professionals. It's an impressionistic snapshot rather than a very systematic one, but we saw enough of what's going on to confirm to me that this interface between performance and healthcare professional education really does merit attention, discussion and research, and particularly if that discussion can happen across the different disciplines involved.
What we got from the policy advisors who spoke at the event was a strong sense of their investment in this field. Anne-Marie Rafferty, President of the Royal College of Nursing, unwaveringly endorsed the value of the arts in the caring professions. Arts in healthcare professional education is a small strand within arts and health policy, but Alex Coulter, Project Director of the Creative Health Report, reiterated the commitment of the all-party parliamentary group on arts, health and well-being to this area. And John McMahon, Senior Manager of Policy and Research at Arts Council England, explained the Arts Council's commitment to this area of work.
In terms of practice, the take-home message for me was just how varied the field is. So performance-based education of healthcare professionals is not just one thing, there's not just one approach. So there are lots of different ways in which the different sorts of theatre are being used, for example. So we saw examples of very realistic plays and performances used to reflect patient experiences. We saw something called forum theatre, which allows you not just to watch, but audience members to step in and take part in a performance, and using those to act out clinical situations, but also examples where abstract dance is used to really kind of analyse the everyday movements of nurses in this case. We also saw a range of ways in which this sort of initiative might be set up or how it might be led. So one example was led by a nursing student, another by a midwifery academic who happened to have a drama degree. And others were research projects that were being led by theatre or healthcare academics, involving in very different ways professionals from the arts industry. So for me, a really important next step is to think in more detail about what people are doing when they work in this field, and how they're doing it, and why one might work better than another in a particular context.
The other thing that came across was the appetite for this work. When we moved to the event online, we worried that our agenda may seem low priority in the context of a pandemic. In fact, we were surprised by the buzz and excitement that came through in tweets and comments about it from practitioners, educators, and renowned scholars in the field. COVID-19 actually only highlighted the importance of this area of study.
Yeah, so that point was really strongly endorsed by Anne-Marie Rafferty, who's also Professor of Nursing Policy at King's College, as well as the President of the Royal College of Nursing. So I'll quote what she said, because it really affected us. She said, "At this time of crisis, what could be more appropriate than to think about ways in which the arts can actually help us cope with the huge uncertainty that we're facing? I can't possibly see that there is a more important time to be discussing this topic."
The pandemic has highlighted how exposed and vulnerable health professionals are, and how the hero narrative too easily draws our collective attention away from fundamental inequalities and injustices affecting the workforce, including, of course, the disproportionate vulnerability of some ethnic groups compared to others. It's made it even more evident to me how important it is to prepare healthcare workers to emotionally demanding situations, especially at time of crisis. Using performance and other art as part of healthcare workers' training and professional development is one way to do this, although of course this should not be at the expense of adequate funding of the service. In her talk on our website, Susie Wilson from Performing Medicine, she said, and I'm going to read her words, she said something that we found really important. She said, "The situation with coronavirus presents a radical moment to reimagine our health and social systems, and for arts and culture to be at the heart of this new vision." Now, too often, arts-based approaches to learning have been and still are considered sort of a nice addition, so to speak, to the fundamental competencies and scientific understanding in which care is rooted. We said earlier that performance-based learning can foster skills and sensibilities such as critical reflection, embodied awareness of self and others, connection-based communication. We think that these skills and sensibilities, far from being an add-on, are actually at the core of the professional competencies of all healthcare workers.
COVID struck at a point in time when there was already a lot of interest among artists in socially engaged practice. That is, artists who engage people in arts and creativity because of their positive social well-being or health effects, rather than just for entertainment. So many of the artists who are already doing this sort of work rallied really quickly when COVID struck, to meet the needs of people who are variously affected by the crisis and by lockdown. So there's increased public recognition at the moment for the positive effects of the arts, particularly around mental health and well-being. So the obvious next step is to think more about how these well-being effects of the arts might be extended to healthcare workers.
It's ironic that this public recognition for the value of the arts comes at a time when the arts industry is in serious economic peril, which the belated but generous government bailout only partially relieves. And also when everything we look for in the performing arts, that is embodied, experiential, interactive experiences, is associated with health risks. So it's hard to say at this point what COVID exactly means for the performance in healthcare professional education field of research and work we are trying to take forward, as most of the projects we showcase at events are currently on hold.
Having said that, there are a few kind of small scale initiatives that have been going on through COVID and lockdown. One I want to mention is Performing Medicine's work. They've made a really ingenious resource, which is a guide to working in PPE, made with the advice of performers who work in costumes and who really know about how to communicate when your face is obscured or when breathing is difficult. I have also been able to work during lockdown, converting some of the live workshops that I had developed with the nursing school at Kingston University into these digital resources. And I've made a resource for nursing students who have gone into practice under the new NMC emergency standards, and another for those who's taking the academic route, either because they're earlier in their training or are locked it down themselves, shielding themselves, and where they're not getting interactive learning. So we've created a resource for that. So it's really strange not using ArtSpace resources and not doing it in a live interactive context. But these small scale initiatives do give me hope for the future, because they've managed to reach further than would have been the case if we were doing live work. So I see them as quite a small but quite a promising sign for the future of performance in healthcare professional education.
Some of the academics who attended the event have committed to forming a working group. The aims of the working group are: 1, to map existing initiatives; 2, to promote interdisciplinary research, and we've already been approached by a couple of journal editors; and 3, to link to and develop networks across arts and health and healthcare professional education.
We already have a date for what might be the working group's first public event, 20th of November. Check the website where we'll announce further details if that goes ahead.
In fact, please do visit the website if you haven't done so already. All the videos from the presentations and the examples from the showcase are still there and free to access, and you can look out for news of forthcoming development. We recently added new material. For example, we now have a bibliography, a showcase from Healthcare Action Training in Northern Ireland, and information about those learning resources that Alex mentioned earlier.
So we would have very much liked to be in the same room as you when we gave you this update. We'd have quite liked to have been in the same room as each other. But still, we hope that you found this brief report useful, despite the split screen format. If so, please do, as we've said, visit the website, where you can also register your interest for the working group if that's something of interest, and sign up to learn about any future activities. Goodbye, and thank you very much for listening.
Thank you, bye-bye.